Which of the following is a possible complication of amniocentesis? A. Needle injury. B. Miscarriage. C. Rh sensitization. D. All of these. The answer is D. All of these. There are several risks to amniocentesis, including, but not limited to, miscarriage, infection, needle injury, and Rh sensitization. The rate of miscarriage due to amniocentesis is between 1 in 300 and 1 in 500. The other complications listed are relatively rare. Fundal height of a pregnant woman is measured from dash. A. The middle of the pubic bone to the bottom of the uterus. B. The top of the pubic bone to the middle of the uterus. C. The middle of the pubic bone to the top of the uterus. D. The top of the pubic bone to the top of the uterus. E. The bottom of the pubic bone to the top of the uterus. The answer is D. The top of the pubic bone to the top of the uterus. Fundal height, sometimes referred to as McDonald's rule, is measured in centimeters from the top of the pubic bone to the top of the uterus. The top of the uterus may also be called the fundus of the uterus. It is used to assess the growth and development of the fetus inside the womb. Alex is 17 weeks pregnant. She comes into the clinic to get an alpha-fetoprotein test. A low result could indicate all of the following except dash. A. The gestational age of the baby is incorrect. B. Preeclampsia. C. Fetal trisomy 18. D. Hydatidform mole. E. Fetal trisomy 21. The answer is B. Preeclampsia. Alpha-fetoprotein is made by the fetus. Congenital abnormalities, fetal trisomy 18, fetal trisomy 21, are associated with low levels of this protein. Additionally, so is hydatidform mole. Hydatidform mole is the presence of an abnormal mass or growth inside the uterus. Based on a low result, the physician may want to conduct further testing. Preeclampsia is a dangerous medical condition characterized by high blood pressure. It is not associated with alpha-fetoprotein. The nurse is assessing a woman in labor. He knows that fetal bradycardia occurs when the heart rate drops below dash. A. 110 beats per minute. B. 120 beats per minute. C. 90 beats per minute. D. 100 beats per minute. E. 130 beats per minute. The answer is A. 110 beats per minute. Fetal bradycardia is recognized when fetal heart rate drops below 110 beats per minute for 10 minutes or longer. The normal fetal heart rate is between 120 beats per minute and 160 beats per minute. Fetal tachycardia is a heart rate above 160 beats per minute. Anne, a 32-year-old woman, presents for her first prenatal visit. The doctor orders a CBC, complete blood count. Which of the following is not included in a CBC? A. Blood type. B. Hematocrit. C. Hemoglobin. D. White blood cells. E. Platelets. The answer is A. Blood type. A separate test called a type and screen is needed to assess the blood type. Complete blood counts, CBCs, typically contain hemoglobin and hematocrit, platelet counts, white blood cell counts, and red blood cell counts among many other measures. They are among the most frequently ordered laboratory tests by providers. The physician will use this information to diagnose conditions such as anemia,